And then I think the biggest thing that you hit on a few times is that like you're so in tune with your body, but most people forgot how it is. Most people don't even live in their body.
I know.
And like I'm really passionate about this. We need to reignite this biological intelligence that we have within us, that we were born with. Like babies will refuse foods that are not good for their constitution without thinking about it. So it's like really, that's why it's important to sit with your food and then like be with your food, and then like, are you good for me? Or are you gonna help me like have a stronger brain, or are you gonna help me be happy, right? A lot of people like love to eat, but they actually eat because they feel more love through that. So, you know.
Well, I want to start by just orienting from how you got into this space and like what you do specifically. How do you describe it? It's bioaesthetic. Is that like the official term?
Well, that's the thing. I don't like labels, and then you have to have so many labels to describe what I do.
I know.
It's a combination of a lot of different things. So yes, bioaesthetic dentistry has to do with figuring out the root causes of dental diseases, which usually stems from like misaligned teeth or worn teeth and jaw joint issues. But then I combine it with functional medicine principles and then Ayurvedic principles where we look at deeper root causes, nutritional root causes, gut, and then also like the spiritual connections that I'm getting more into now with medical intuition and understanding energy bodies and all that. It's like so exciting.
Oh my God, I love all of it. Yeah, I mean, that's why I came here. When I first moved, I needed a new dentist, and it's hard for me to find someone that I resonate with. But at the time, like I loved like the functional medicine approach that you're integrating in, because that was super important to me. And I think for people who are like looking for a dentist in their area, like what's the difference between just like a biological dentist, a holistic dentist? Like what terms would somebody be looking for?
So there's like so many different kinds. I think the most of them focus on not introducing harmful materials in your mouth. Some of them have a really good understanding of how the body is connected and the mouth is connected. But I'd probably say to call them and ask them about like, how are they helping their patients achieve overall health? Not just like fixing cavities, but what are the programs they have? What do they do? Or how do they get involved with their patients' overall health?
Yeah. That's the thing, because I think a lot of people in the health space like look for a biological dentist, but there are a lot of biological dentists.
It's a trend right now. Everybody's catching on that people are wanting that. So then you can just... I know some people hate me for this, but you can literally just pay this organization a yearly fee, and then you could call yourself a holistic dentist.
Wow.
Without any training, and then you'll be listed on their link. So yes, they expect you to get trained. They have really good training, but you don't have to.
Yeah. I mean, that makes sense to me, because that was what I was bumping into. I mean, in San Diego, I had this problem too. Like I couldn't really find anybody, and there are a lot of people labeled holistic dentist or biological dentist, but then there were a couple of people I went in to see, or I would just call the office, and I felt like they were not really aligned with what I was trying to find, you know? And so I think from my side, it was like when I saw about your background with the functional medicine and bringing that in, that's like what stood out. So it makes sense, I think, like kind of looking into someone's actual training and background. Okay, so how did you come into dentistry? Because you didn't start there, right?
No, I actually started a long time ago. I was a nurse. Then I went to medical school, and then this was in Europe. Then I had dental school, and then when I came to the United States, I went back to dental school. But that medical background always stayed with me. And then after practicing for a couple of years, I saw that there was like a complete disconnect. That we're just like, mechanics of the mouth, and then we're forgetting that there's a whole other human being attached to it. So I was like, I don't want to practice like that. That's not for me. So I started looking and searching, and when you're looking and searching, things fall into your lap. And then I got exposed to functional medicine, holistic dentistry wasn't quite it. It seemed like it was all over the place, unorganized. Everybody was doing something different. And then functional medicine seemed structured in a way that I could understand it. And then I just kind of went deep into it and I got certified in it, which was very, very hard. But, and then that opened new avenues because I started working with functional medicine, seeing a lot of patients and seeing that there's still something missing, right? And then I discovered Ayurveda. I was guided to that. And I realized like, okay, like the spiritual, emotional, like this whole subtle side of the human being is completely not being helped. And without that, you can eat the best diet that you want and it's still not going to get better.
Yeah.
Yeah.
I mean, I think that's what like resonates so much for me. I'm like so picky about anyone I work with in any capacity because I'm like very sensitive. I'm sensitive to energy, and I always feel like people try to put me in a box. Like I dealt with this a lot with my health issues, where I would try to describe to my practitioner, even like the functional medicine doctors I was working with, I'm like, there's an energetic thing going on here.
Yeah.
And I know that's what's causing this problem. And they were just like, no, it's this, eat this diet and take these supplements. And I was like, no, there's like an energetic to this. And so I'm always really cautious because I know that to be true. Like I know how my body works. And I think that's why it's so important you guys are able to combine all of that and see from that perspective, because there are things that sometimes like don't logically make sense based on what we know, like in scientific training, but then you add in like these other types of sciences, like these other types of studies, and suddenly it does make sense, you know? Totally. So I think that's amazing. I'm curious, before I get more into that, how was like dental school different overseas versus here?
Overseas, there's a lot more emphasis on knowing all the medical sciences. So I had to know how to deliver babies, how to listen for what, like we had to tell based on listening to their heartbeat and measuring the woman, how far along she is without any ultrasound. We needed to know all the medical sciences because there's like a high need for doctors. So sometimes a dentist can end up on a countryside and has to do medical doctor related work too.
Wow.
Yeah. So that was intertwined more, like the overall health was more intertwined into dentistry.
Okay, so you're coming in from that perspective, and then probably when you get over here, it's super obvious to you that we're so disconnected with how we're trained.
Yeah, and then the other thing was that when you practice from a place of just, drilling, fixing, it's like a mechanic work, then patients don't even own their problems. They're just like, well, you did that filling. I'm like, well, I wouldn't do a filling if you didn't have a cavity. But because you never owned it, you never asked yourself, why do I get cavities? Then I wasn't really helping anyone.
Yeah.
Yeah.
Oh my God, so true. I mean, I feel like everything that happens in your mouth, I mean, just the energetics of that, we know like with the gut and how that's connected to the rest of our body. And I'm sure like I want to hear from you about how that connects to our whole body. But energetically, I mean, this is our main chakra. Like this is our main manifestation chakra. Everything comes from this place. And so like if we're not taking care of this, that has huge energetic effects on the rest of the body. Like I feel like if people just focused on their mouth, everything would get realigned positively. Like if they're getting overwhelmed, honestly.
Yeah. Almost everything.
I mean, a lot of things. It improves a lot, you know?
Yeah, definitely. It's our speech. It's our taste. It's like in Ayurveda, they say the prana, what you inhale, and the udana, which comes up. So there's like the upward and downward movement of energy constantly there. Yeah.
It means how we express to the world, right?
Yeah.
So when I first came in and I do my new patient thing, it's like very different than a regular dentist office. Can you talk about some of the things that you guys test and do here that are different? I don't even remember what I did, but I just remember it was like a whole thing, and you guys were testing things that I'd never been tested for before. So when a new patient comes in, what are the things you're looking at with their mouth and testing and looking? Yeah.
So we test for the saliva pH. So we want to know where you are at that moment. Also, we test for the bacterial profile that somebody has. And then we test to see if somebody has yeast, viruses, certain viruses that could show us how your immune system is functioning and if the bacteria you have are more aggressive or not. And that helps us customize care. I got that idea actually from functional medicine, where they have the 5R protocol of how to restore restore somebody's gut in a structured way. So we have this 4R protocol for oral health. Is like, first is we want to identify what you have, like what's your starting point in microbiome. Then we want to help you remove the harmful bacteria that can cause systemic issues. Also remove any bad habits, like sugar or not brushing properly or using the wrong products. A lot of people use very toxic stuff that actually disturbs the oral microbiome. And then we want to repair the gum lining. If somebody has, for example, gum disease, oftentimes just brushing is not enough. They're deficient in a bunch of nutrients that help with the integrity of the gum tissue. So we'd have them take like vitamin C, A, D, E, K, fish oils, even amino acids that help build tissues. A lot of people are deficient in that too. And then we have them replace the bad bacteria with good bacteria. So they'll chew like a probiotic tablet at night that helps put good bacteria back into the mouth and then upregulate the immune system in the mouth. And then the last part is like rebalancing your lifestyle, because often people get excited about, like, I'm going to do all this, but then they don't and they fall off. So how can we help them to maintain that for life?
Yeah.
Yeah.
So to be clear, you're talking about the microbiome in the mouth.
In the mouth,
different than the gut.
Very different.
How are those like connected / different for people to understand?
Well, it's they have different functions. So like the microbiome in the mouth has to do with protecting you because there's a lot of invaders that come in through our mouth. Also, it starts digesting starches, like carbohydrate digesting starts in the mouth. And at every level, in the stomach, in the small intestine, large intestine, you'll have different types of bacteria because they do different things. They break down different types of food or reabsorb. And we're actually like bottom feeders because we have like 7 different layers of bacteria that digest the food for us first, then we get the leftovers.
Sounds about right. So if somebody is having gut dysbiosis, does that affect the microbiome in the mouth? Or is it like just stay separate?
Well, nothing is separate in the body. When you have dysbiosis in your gut, it's usually due to not eating the right foods and eating too fast or eating too heavy food, so your body cannot digest it. So then when you cannot digest your food in your stomach, then it goes into your small intestine and just putrefies there. And that makes the bacterial population shift. So when you have that shift, then your oral microbiome is going to change because your body's going to have more toxins, more acids in it. So that's kind of how they're connected. Now, bacteria from the mouth can also, because we swallow our saliva, end up in a stomach. And if somebody has low stomach acid, they can end up in a small intestine and contribute to small intestinal bacterial overgrowth.
Oh, okay.
But it all starts from our habits around food.
Yeah.
And our mindset and emotions when we're eating.
So what's the ideal state?
The ideal state is gratitude.
Yeah.
And then sitting down with your food, connecting with your food, because it's our nourishment. So food turns into us. And if we don't really respect it. So having like a regular diet, eating breakfast, lunch, and dinner always at the same time in a positive mindset, grateful, not on the phone scrolling or watching things, because then your digestion goes away.
Yeah.
Like your attention
People are going to be watching
away.
this right now while they're eating. Like I'm not digesting.
Yeah. Well, after this, don't do that.
After this. Start after this. Yeah. Well, so people like take probiotics regularly for their gut. Should people be taking probiotics regularly for their mouth?
Yeah,
they should.
It's a good idea.
Okay.
But ideally, if you restore your health and like that intuition that you talk about, that biological intuition when you know what's good for you, you might not need it anymore because we should be able to get it from our food.
Okay.
Yeah.
I've seen, actually, I just bought one. I try all these different non-toxic toothpastes. Do the toothpaste with probiotics in them, do you know much about that? Like, do those work?
I mean, they try to put them everywhere they can. I don't know. I would have to see, like, read the studies on that. There's like, they're getting creative in how to make things simple for people. So I'm sure they work because they're in your mouth, but it just depends on who makes it.
Okay. Like, what's the best form? Like a capsule?
Probably. Yeah.
Okay.
Yeah.
That's what you guys recommend?
Yeah.
Yeah. Like, I know when I came in, you guys tested that, and then I was like put on a little protocol.
Yeah.
I forget what I had. I mean, I'm sure I had all kinds of things.
Dental sidin, biocidin, which are really great. There's a lot of studies on them that they decrease the harmful bacteria pretty fast. Yeah.
I mean, I definitely noticed a difference. I didn't really think honestly, at first I was like, I don't know. I was like, oh, it's in my mouth for 2 minutes when I'm washing with this. Does it make a difference? But then after like a month, I was like, oh, I actually feel different intuitively in there.
Cleaner.
Yeah. I feel it just felt different.
Yeah.
It definitely works.
They're made with herbs, so herbs are intelligent, and they won't disturb your own microbiome, but they will help eliminate the bad bugs.
Yeah. So when people's pH is off, like you said, often they're too acidic.
Yeah.
What's causing that? And how could someone fix that if it's too acidic?
It could be many things. It could be the foods that they eat that creates like an overall acidity. They could have not enough stomach acid, believe it or not. And then when they don't have enough stomach acid, food just stagnates in there and creates toxin buildup, and that causes acidity. Also, acid reflux. When somebody is not digesting their food and acid comes back up, that can create that acidic pH also. And mouth breathing. There's a lot of things.
Yeah. Okay.
Poor oral hygiene, like if somebody's not brushing properly, not like tongue scraping, because bacteria build up on the tongue also.
So if it's coming from like acid reflux, what do you recommend?
They have to see a gastroenterologist just to rule out that there's not like ulcers inside the stomach. And then I would say the same thing. Look at your diet. Like, are you eating at the same time? What is your mindset? Usually acid reflux is related a lot with anger or emotions held in there, or like repressed emotions. So look at that also. But like eating smaller meals. And then easier to digest, not drinking coffee, acidic stuff, fermented foods, too much salt, all those things just like aggravate the stomach. And then maybe some aloe vera juice that helps like cool the stomach. Think of cooling things when you have too much acid.
Yeah. Okay, I like that tip. You mentioned before, well, I'm curious, what are like the most common things that you see going on with people if they're having dysfunction in the mouth? Like, there's probably the acidity piece.
Acidity,
but
coated tongue.
Coated tongue.
And then really badly worn teeth, or gum disease, really.
So let's talk about coated tongue. What causes that? What does that mean?
Many things. Food can cause it. Like if you drink coffee or chai, it could make your tongue a little bit wider.
Yeah, like when I came in here and I had goat milk for breakfast, and they were like, "What's wrong with your tongue?" I was like, "Oh, I just drink goat milk."
That's funny.
Yeah.
So yes, your tongue. So the best thing is to do is when you wake up in the morning is look at your tongue, because that's when you see at night your liver detoxes, and I'll show you what is putting on your tongue. So if it's really white, that usually means that there's the digestive tract is slow, so there's like toxic buildup in the colon, and toxins are building up because you didn't digest the food from the day before or from many days before. If the coating is more yellowish green, then people could have problems with their liver. So there's too much liver or gallbladder issues in their body. And if it's like blackish, you could have really severe bacterial and parasites overgrowth too.
Wow.
Yeah.
I didn't know there could be black.
Yeah. And the tip of the tongue, the redness on the tip of the tongue could signify the mind, if there's too much thinking and too much emotion in the mind, or your thyroid dysfunction.
Okay.
Yeah.
Is that also like, do you know much about the scalloped tongue thing?
Yeah.
What's that about?
I do. So that could also be two different things. One is in functional medicine Ayurveda, they say it's caused by malabsorption. So somebody's not able to, again, digest the food and absorb its nutrients. And the other thing that I see in dentistry is when people have a misaligned bite, oftentimes they use the tongue as a brace. So they suck the tongue between the teeth at night especially, and that leaves the indentations of the teeth on it.
Oh, I mean, that makes sense.
Yeah, they're just like literally put the tongue between the teeth to prevent themselves from clenching.
Okay, that makes sense. So in terms of the coating on the tongue, should there just be nothing on it? Is it like ideal health?
Yeah.
Okay.
It should be nice and pink and healthy. There should be no cracks in the center, no like dimples in it. Should be a nice, healthy looking pink.
Wait, so if it has a crack, that means there's problems?
There's problems, yeah.
Oh
And
my God, I
depending on
definitely
where
have
the crack is.
Wait, what does a crack mean?
So it depends on where it is and how
Okay.
long it is and the shape
It's
of
like
it.
palm
It's like
reading.
it's like palm reading totally, yeah. And like where they're
Wait.
located.
So is it connected to like nutrient deficiencies? Is it like
It
organs?
could be organs, yeah.
Emotions,
Organs,
all of it?
all of it, yeah.
Whoa.
Yeah.
Wait, I want to tongue
Like you could
analysis
you
later.
could yeah, you have to look at the whole, so you can't just look at the tongue. You have to
Yeah.
always look at the whole person
Yeah.
and everything that's going on. But yeah, you could see a lot from the tongue.
Oh my God. Okay.
Yeah.
So perfect world, because we're all tongue scraping, right? We're tongue scraping. With what kind of tongue scraper?
Copper is the
Copper?
best, yeah.
So you're scraping and like ideally nothing's really coming off because you're
Not really,
coated?
just like clear mucus.
Okay.
Yeah.
Okay. Good to know. Good to
Yeah.
know.
Or if you like, you had a bit of a party, because nobody's perfect, right? We have
Yeah.
to have fun. You party a bit last night and you wake up and you see it. You're like, at least you see that white coating, then you know you have to eat a little lighter that day.
Okay.
So you let your body digest the previous day.
Okay.
Just
By
take it
lighter, do
easier.
you mean like less food, or do you mean like just like lighter foods? In terms
Less
of,
and
like,
lighter food, like no
Okay.
like dairy, heavy, creamy things, no fried foods.
Okay.
People have a hangover and they eat fried food.
I know.
So it's like really not good.
It's a bad cycle.
Yeah.
Toxic cycle.
Yeah. Like having some ginger tea. Ginger tea helps you
Yeah.
digest. Ginger with lemon and honey is really good. Yeah.
Okay. Okay, cool. Let's move to the gum disease
Okay.
part. I know nothing about gum disease. Like, what's causing that?
So I think I told you gum disease can be caused by many things, but the actual mechanism is when bacteria that sit at the gum line, if somebody doesn't brush efficiently or they have health issues, bacteria sit at the gum line and the whole microbiome changes into more aggressive one for many reasons. And then these bacteria start melting away the attachment that the gum has to the tooth. So the gum usually seals up against the tooth, preventing bacteria from going into the bone. And then it's like literally they just like leaky gut, leaky gums. Like they detach these tight links with the tooth, and then they start invading and going into the bone.
Wow.
And then once they get to a depth where they survive without oxygen, you can't even clean it because your toothbrush doesn't go that deep. So they just like thrive there, and they start eating the bone away, and it's not painful, which is the weirdest thing. And then people don't really notice it till they start having bad breath or bleeding gums. Those are like the first signs.
Oh, whoa.
Yeah.
So if someone, it's probably like the dentist would notice it, right?
Yeah.
And tell you. Is that something that's easily reversed? Is that hard to help? Is it?
It takes time, and it
Yeah.
depends on because you have to fine tune the person's nutrition, their overall health, and then the local measures. Like they should really disinfect, throw away the old toothbrush head, and then disinfect their brush regularly, because you have to now shift the oral microbiome back to a healthy one, and then encourage the attachment of the gum tissue back onto the tooth. So that's very nutrient dependent, and you have to keep the area very clean. That's where the dental side in toothpaste is great, because it helps keep the bad bacteria at bay.
Okay. What are the nutrition changes? Some of the nutrition changes somebody would make?
So same
that?
thing, lifestyle is very important, like
Yeah.
eating at the same time.
Okay.
And then based on their specific constitution, like in Ayurveda, everybody has their own constitution, then you'd help them switch over from the foods that are harmful to them to things that are better for them. And then we also offer like a functional medicine component where we have a nutritionist that we could do testing, because that's also good, because when you know what nutrients you're missing, you can supplement, like target supplement till the person gets better.
Okay, cool. If somebody deals with bad breath, like what's really causing that? Usually.
So it could be the bacteria that eating the gum away. It could be bacteria growing on a tongue. It could be bacteria growing in a tonsils, or it could be cavities. And it could also come from the stomach. If somebody has like H. pylori overgrowth or other problems with their stomach or indigestion, then that breath comes through there.
Okay, so typically, like
That usually
bacterial.
happens on empty stomach when people have that bad breath.
Yeah.
Or first thing in the morning.
Yeah.
Yeah.
Okay. So
Sometimes
it's like a sign
you could taste it too.
Yeah, like deeper testing, basically.
Deeper testing,
There's
yeah.
something else going
Yeah.
on. Okay. But you've seen this stuff like get reversed, go away.
Yeah, totally. Yeah. Everything is like, I was told in dental school is that once you have gum disease and diabetes, you have it for life. And when I learned functional medicine, I knew better. Everything can be reversed.
Can tooth decay be reversed?
Some of it, yes. If it's in the very beginning stages and it's an area that's very easy to clean.
Mm-hmm.
Oftentimes in between the teeth, it's hard because it's hard to get stuff in there that you could heal that area efficiently. But I've seen it.
Like, how would you reverse it?
So really good diet. Mm-hmm. So cavities are also a sign of indigestion. Are not absorbing your food, malabsorption, not getting nutrients in your body. So that would be something that a person would have to focus on. Habits, flossing is one of the biggest causes. Mm-hmm. Not flossing is biggest causes of cavities.
Yeah.
Brushing properly, and then using hydroxyapatite. And then hydroxyapatite that's you can find in most products now, and then applying that to the area to help the hydroxyapatite remineralize the enamel.
Okay. What are the most important nutrients for like supporting tooth health, right? Like you probably see common deficiencies people have that are probably connected to their teeth not doing very well.
That also again has to do with not like the stomach not having enough strength to break down the food, and then the small intestine. Yeah. So it always it starts right from here. Mm-hmm. And vitamin C deficiency, vitamin D deficiency affects it. A lot of people are vitamin D deficient. We think we get enough from the sun, but some people cannot convert it. Fish oils, like the omega-3s, they're deficient. Amino acids. Mm-hmm. Free-form amino acids are so good to take because they balance your brain chemistry, serotonin, so all that. A lot of people are deficient.
Yeah. Do you take amino acids?
I do in the morning.
What
It's
kind?
Not every day.
Yeah.
Amino acid supreme from Designs for Health. I like that one.
Okay, cool. How do you feel about plant-based diets?
I'm all for it.
Mm-hmm.
I've tried so many things.
Are you plant-based?
Not anymore.
Yeah.
I did that for quite a while, but I felt like my body was telling me that I needed to eat meat.
Yeah.
Not a lot, very little bit. So just enough where my body's like, okay, this is good. And then my body will tell me, no, don't eat meat right now for like a couple days. Mm-hmm. So I kind of learned to listen to what my body tells me.
Yeah.
Yeah.
I was plant-based for a couple of years. I mean, I didn't eat any animal protein for 2 or 3 years. I don't remember, and I was supplementing, and I'm like pretty smart, I used to be a nutritionist. So, but my teeth started like turning gray and like translucent. And then I started eating animal protein again, and my teeth started getting their color back. Is that something you see?
You can definitely. Yeah. Long time ago, they did this cruel study where they, what kind of cruel? They wanted to see how long it takes for nutrients to get to the teeth, or lack of nutrients, I would think. So they took this radioactive dye and they put it through into the dog's stomach, and then they took the teeth out and they looked to see how many minutes it took for the nutrients, the radioactive product to get into. It took 5 minutes.
Whoa.
To get into the teeth, because the tooth is connected to the blood flow of the whole body. So anytime you have food that absorbs, it goes through your whole system. Mm-hmm. So yes, it can. So if somebody's eating a really bad diet, that affects how the nutrients in the blood. So the tooth doesn't get its nourishment. It's almost like a plant that you don't give nourishment. It'll start like withering away, and the leaves start getting brown. It's kind of what happens to the teeth with cavities.
Wow.
Yeah, they dehydrate and they just become nutritionally deficient.
That makes sense to me.
Yeah.
Well, there's been a couple times talking about like having a better diet. Like, what does a good diet mean to you when you're saying that?
A good diet, I would say, eating foods that are natural, nothing processed, as least processed as possible, and then eating in season. Now we have access to any fruit and vegetable, and sometimes that's not a good thing. So like eating a lot more vegetables and fruits, and kind of knowing where your food is coming from, I think it's important, especially when you get your meat. And then balancing it and learning how to listen to your body instead of following all kinds of fad diets.
Yeah. How do you feel about dairy?
I think it's good for some people, like even in Ayurveda, for like people that are stressed and have like a high stress lifestyle, they recommend drinking milk. I mean, I would say A2 milk, because nowadays milk is not the best, or organic A2 milk or raw milk, but you have to boil it because raw milk is hard to digest, especially at night, like a latte, like like a turmeric latte in the evening, because milk is grounding. Milk is sweet, grounding, and nourishing, so it offset the stress that you went through the day.
Yeah, that makes sense. Probably why I love milk.
Yeah, because you're
I
like
love my goat milk.
When you have your skills, there's like the air and ether element, which is like, and then it needs the grounding of the sweetness of the milk.
Yeah, I have to really balance that, like, because I'm spending so much time up somewhere else, and so I definitely need to balance it. Yeah, and I need things that are really easy to digest because I'm digesting so much energy nonstop. Yeah, so it's like I need a lot of energy consistently, but it can't be too heavy because otherwise I can't channel and bring it down. So it's like that balance. Yeah. So, big goat milk girl over here.
Goat milk is good, yeah.
Yeah. I don't know if that's good for me.
It's a little lighter
in terms of Ayurvedic, but whatever.
They like goat milk, goat meat, and
I always talk about this. Have you heard of the goat doctor?
No.
Okay. I have to send you this. I talk about this a lot on the podcast, but one of my clients actually recommended this book to me. She asked me, she said, "Have you heard about the goat doctor?" I said, "No." She told me there's a book about him, and it was this healer in Sacramento. And the book is really hard to get. Like, they've hidden information about this man, but long story short, he was an immigrant, and was adopted by this family. He almost died of tuberculosis. The woman who adopted him was a psychic, and she took him into like the hills off Sacramento in the middle of nowhere to heal him, and just like put him in the earth, like literally dug a hole. He was in the earth, and fed him goat milk and goat meat and like fruits, and he healed. And then she trained him in his psychic abilities, and he became this incredible miracle healer. They've had like TV shows and stuff about it, and people would literally people would sit in their cars for like days and days, weeks and weeks to go see this guy. Wow. And there was like a giant pile outside of his little room where he would do the healing of wheelchairs and crutches. People would literally get their sight back. It was like so incredible. But the book that I had read was just a ton of different anecdotes of all thousands of people who had seen him. Wow. So you're just hearing from all these different people, and they're all describing him. And when it came to diet, he would always just tell people, like, you need to go get a goat and just drink goat milk, or go eat goat meat. And I had intuitively, before I even read this, I kept like getting guided toward goat products, but I wasn't really into it then. And then I read that book, and I'm like, I'm a goat girl now.
Goat girl.
But it was just a really. But cool
even
story.
in Ayurveda, somebody has like protein deficiencies. They recommend goat meat soup.
Wow. Yeah. Specifically that.
Goat meat soup, always. That's the go-to when somebody has protein deficiency or very ill. Goat meat soup.
Why that specifically? Why that kind of protein?
It's easy to digest, and it's a good protein.
Wow.
Yeah.
Wow. Good.
Nourishing.
To know. Yeah. There's a lot with the goats.
The
goats are sacred.
Yeah, they're so cute.
Yeah, they're so cute. So sacred. Okay. So what about enamel like wear down? Like, I mean, I have a lot of that. Like my teeth are just ground down. Is that because people are clenching a lot typically? Like, what are the different reasons why teeth are worn down so much?
It's like when we get to a point where we see it, it's hard to know what started it. Yeah. It could have started with orthodontic treatment where they move the teeth really fast, and then your joints didn't have time to adapt to the changes in the bite dynamics. Wow. It could be wisdom tooth extractions where again the joint or the muscles get slightly out of alignment, or it could be that when the wisdom teeth come in, they come in at an angle and they push the rest of the teeth to crowd. And then your body is like a refined mechanism, so it wants to create a pathway that has has to exert the least amount of effort to chew. So if there's a tooth that's out of alignment, it'll start making the person clench and grind to get that tooth out of the way.
Wow. Okay.
But then I've also seen people that hold a lot of their emotions and stress in their jaw. So then they just start habitually. It's almost like it creates like an endorphin release when somebody's grinding, and they get hooked on that.
Yeah.
Yeah. You could see people like focusing on you could see their like this muscle is like this.
Yeah. I mean, I feel like I had all of that. Like, I feel like the wisdom teeth thing, I think the orthodontics, moving things fast. And then I also think I was drinking way too much coffee for a long time, and a lot of my clenching just stopped after I like fully got off coffee. So I think that was the thing for me. There was something that you had told me, I don't remember exactly, when I first came in and you were figuring out my misaligned bite, which I had literally seen like 15 different dentists, and you figured it out within 30 seconds. I was like, what? But something about trauma, you were saying like you see a lot in women. I think you said like 20 to 35 or something, like traumatic events can like, was it like shift the jaw or like cause inflammation on one side?
Yeah,
or
so
like that?
degenerative joint disease, it's a thing that's really not diagnosed. So degenerative joint disease affects mostly women. It could be triggered by hormonal changes in puberty or later on. And what happens is there's this like whole protein switch where more like enzymes that get turned on that start eating away the bone, the jawbone, like this little hinge here that opens and closes. It's a ball, and then in these women it ends up being deformed, and it can be activated by orthodontics, by trauma, by accidents, and then eventually it stops degenerating. But by the time it changed the shape from round to something else, now you have a ball and socket that's not really working properly. So then the jaw is going to adapt by the muscles will contract more on one side or the other side, so that causes headaches and migraines in women, and neck pain and jaw pain.
So how does one address that? What kind of help?
So there's because the degenerative joint disease, most of the ones we've seen are like they stop, so they're not active. So the goal would be to stop it from reactivating. So anti-inflammatory diet, avoiding too much stress on a jaw, and then kind of restabilizing the bite to make sure that when you close your teeth together, there's not excessive forces or an imbalance in your joints. Because when this one is smaller, this one is bigger. When you open and close and when you chew, one will be overloaded.
Is that what I have?
Yeah,
Mine's all messed up. We're fixing it. So,
and I've been talking about a few people about stem cell therapy. Like, you know, there's hard to find someone that would inject stem cells into the joints. And I haven't found one here in Arizona yet, because it's like I would like to see what that does. It would be nice to see if you can regenerate something.
I might have a lead for you.
Yeah,
talk about
that'd
it
be
later.
great. Yeah.
I think I have a lead for you. Yeah, that's actually really interesting.
Yeah, and I'd want someone that uses ultrasound, because then you can actually see the components of the joint and know where to put it. Yeah.
Wow, that's so fascinating. And I feel like there's so much they could probably do that we just haven't like figured out yet. So when you say like anti-inflammatory diet, what are the top inflammatory foods?
I like fried foods.
Okay, fried foods. Like just straight trash food.
Yeah,
like,
trash food.
Is there anything like
packaged
that
food
people think are healthy that's inflammatory? Like, do you consider caffeine, like coffee, an inflammatory food?
It's acidic. It can.
Okay.
And like certain people that have more of the fire element in them, coffee could be very damaging.
Yeah.
Yeah.
I want to talk about it. Like this whole thing's just
That's why I got
at
something
me.
else.
Yeah, at me. I know. I'm like, make me a coffee. I just had 2 sips today. But okay, I just wanted to clarify, you know, because I think sometimes, like for me, I eat really healthy. I've eaten really healthy for a long time because of all my like previous chronic health issues. But like even things that are healthy for my body, because I'm like more sensitive, like have a lot of fire in me, like was still causing inflammation. You know, I think it's important for people to know. It's like it's about your unique body.
Yeah, definitely. Yeah.
You know.
And then I think the biggest thing that you hit on a few times is that like you're so in tune with your body, but most people forgot how it is. Most people don't even live in their body.
I know.
And like I'm really passionate about this. We need to reignite this biological intelligence that we have within us, that we were born with. Like babies will refuse foods that are not good for their constitution. without thinking about it. So it's like really, that's why it's important to sit with your food and then like be with your food, and then like, are you good for me? Or are you gonna help me like have a stronger brain, or are you gonna help me be happy, right? A lot of people like love to eat, but they actually eat because they feel more love through that. So, you know.
Yeah.
Have
you always been like very connected to that, or did you ever feel disconnected from that?
I've felt disconnected from it. Yeah. Like I was more connected to it as a kid. And then I had no digestive issues, no real problems as a kid. Then I came to America, and then I got disconnected from it. So I had no idea. Like when I came here, I did not understand what it means to have genetically modified stuff, or like hormone treated cows, or foods that they sell in a grocery store, they're bad for you. Because I grew up in a place, a small town, we bought everything at the farmer's market, which is open all year round.
Yeah.
So I didn't know that stuff existed. So I came here, I got sick, I gained weight. And then one day I remember when I like looked at Ben and Jerry's ice cream, like, our cows are not treated with growth hormones. Like, wait, what? And then I started like digging deep, and I was like, I can't eat this. Yeah.
So what helped you like connect? Changing your diet, or was there more to that?
Well, I had my own digestive issues and my health problems, you know, and then the stress. I didn't understand how stress affects the human mind and the psyche and everything until I started studying functional medicine. And then every course, at the end of course, I was like, oh yeah, it's stress again.
Yeah.
Everything is caused by the way we process life.
For sure.
Yeah.
So what practices do you like to help with that stress?
Meditation every day. That was the best thing that I've ever done. It's like, and if I have like, feel like I had like too much energy coming through my day, I just go and ground myself and meditate. Yeah.
Is there a specific type of meditation you do?
So I love hemisync. Have you heard of hemisync meditations? They're amazing because they have something for anything, and they're based on science. So there's like binaural technology, and they create these like brain waves that synchronize your left and right side of your brain. And depending on which meditation you do, you could do mediumship, you could do things to reset yourself, and they teach you somewhat of a neuro-linguistic programming techniques where you can use those to get yourself in state anytime.
Wow, that's super cool. Yeah, I love that. How long have you been doing that?
3 years.
Awesome.
Nonstop. I love it.
Super cool. I love
and they
that.
have something called the Gateway Program, which is somebody wants to experience out-of-body states and then enhance your abilities. It's really cool.
Wow. Gotta be careful with that.
Gotta be careful with that, yeah. Well, you can't, like, I've done it for 3 times already, and I'm still not, like, there.
Yeah. Well, something for me, I mean, talking about reconnecting, I feel like I don't know that I really connected to my mouth fully until we started doing the Mago device, like, because now, you know, removing it and you're like, you're asking me to like actually pay attention. And I realized I had never previously actually paid attention to how I was biting or what was touching first. I just didn't even notice. Yeah. And I bet most people are like that. You don't think twice about it. Right. But the Mago device we're using, is that something that you do a lot with people? Is that like common that people need that?
It's very common that people need that. Okay. Like jaw joint issues are one of the least diagnosed conditions people have. Yeah. About 90% of dental diseases are caused by misalignments of the teeth and jaw misalignments.
Okay. So let's break this down, because I'm sure a lot of people have never heard of this. I had never heard of it until obviously you told me about it. So people have like misaligned jaw joints, joint issue, and then what is this device doing and how does it work?
So if, let's say you have, just think about it this way. Imagine you have one leg shorter and one leg longer. Like we talked about one joint not being as big. You would have to wear an orthotic for you not to wobble. So it's the same thing. We put an orthotic device in the mouth, and that helps gradually get that joint find its balance point. Because when your joints are not aligned, your muscles are not aligned. So what we're trying to see is how your body will self-adjust. So it's not forcing anything, but it allows your body to find its balance state.
Yeah. Something that was super eye-opening for me, because obviously I knew I was having these problems with my teeth. I was super stressed. I mean, I remember the first time I came to see you and you were like figuring it out, and I like cry every time I would talk about it because I was so stressed about it. And I was like, I'm just storing all of this stress in my mouth, and I knew my nervous system was just online too much. And I was trying to figure out what was causing that, and I honestly think it's kind of a chicken or the egg situation, but I actually feel like because I didn't know where to bite, that's what was causing it. And it wasn't until the longer we've done this and the more stabilized it's gotten, I just noticed my nervous system is calmer, and I haven't changed anything else. And I feel like that's got to be at play for a lot of people. Like, that's stressful. Well, you had said that to me. You were like, your brain is like, where do I bite down?
Yeah, exactly.
And that's just something going on in the background that I'm not consciously thinking about. Of course, I'm going to be in a stress response all the time, and my brain is confused about where to bite because I'm doing that all the time.
Yeah.
You know? So I feel like if anybody is also struggling with that, because so many people in this space talk about the nervous system, right? I think a lot of people come into spirituality and meditation and all these things because they realize I'm stressed, I'm in fight or flight, and there's obviously so many different components to that, lifestyle things, but that was a very physiological thing that was making a huge difference for me. So can you explain more about like how it works, right? So it's basically, it's kind of like, I tell people it's like a thick retainer. It's like a thick night guard. Yeah. Right. And then it's like training my brain or training my jaw. Like, what's actually going on?
So it tricks your brain into thinking that it has like a perfectly even bite, because what we try to do with the appliance is to create, like, when you close on it, the whole upper left and front side to close on it evenly and very lightly. So we control the amount of like surface that your teeth can contact. So then that gives feedback to your brain. Okay, I can relax now. I don't have to try to move or figure things out, because it's more of a platform that your lower jaw can move against. And then when you come in regularly, we adjust that, and adjustments show us like what is happening in your jaw, what's shifting, and we always get you back to that balanced state. And the balanced state is what helps like the nervous system calm down.
Yeah. For most people, about how long is that process? I'm a bad student, so it takes me longer. But
well, you have to travel back and forth a lot, so that doesn't help. But most people, a couple months.
Okay.
It depends on how. I also notice depends on how much trauma they stored in their jaw.
Yeah.
So guys usually release much faster because somehow they do that. I don't know why. Yeah. But I've had somebody that took 2 years.
Yeah.
And then
I'm gonna be 2 years. But I'm also not.
You're not here, so it's harder for you. But she was coming like every week, every 2 weeks, almost 2 years. Yeah. And then eventually, after about a year, it started getting better and better and better and better. Yeah. And now she has no more pain.
Well, those of us who've gotten killed for speaking our truth in past lives, we're gonna store it there. It's a very real thing.
Yeah. So, it is a real thing. What I've seen a few times is when somebody has tons of trauma stored, as soon as you put the device in, within a week or so, it just like off leashes on them.
Wow. Yeah. I bet.
Yeah. I've had somebody, like, we started working on the device and she had cancer in her leg, and it like reactivated the pain in that leg that wasn't processed. And then after a few days, it just goes away.
My God. That's amazing. It's a big release, big shift. So the other thing I wanted to talk about was the tongue. I feel like the whole tongue tie conversation is super popular in social media. I don't really know much about that. I don't even know if I have one. I might. I don't know. Yeah. Do I not?
No, not really.
Okay. Well, great, because I don't need another issue. Like, what's a tongue tie, and like what's that doing for people with their jaws, with their bite? Why is this so popular right now?
It's popular because we're paying attention to it.
Okay.
And actually, yogis 5,000 years ago, they would take their nails and just start loosening that little skin tag that's underneath the tongue. If you lift your tongue up, you could feel it, you could see it. They would cut it because they had this. There's a mudra, like the way you hold the tongue goes back in the inside of your nose, and then it unlocks samadhi, like that immediate enlightenment. So it's been around.
Wait, so should there not be one at all?
Not really, not something that prevents your tongue from being able to roll back behind your throat.
Okay. Well, I have it, but my tongue can do all that.
Yeah, I
Some
can.
part.
You're able to keep your tongue
Okay.
to the roof of the mouth. But
Okay.
some people have the tongue ties where the tongue is tied down to the jawbone in the front, so they can't really stick their tongue out
Oh,
or open
wow.
their mouth and keep the tip of the tongue to the roof of the mouth.
So
So it structurally
Yeah.
affects, because it ties down, the tongue ties down into a little bone here, and then it keeps this bone farther back. So people usually will have difficulty swallowing pills, or they will have sleep apnea because now the tongue is pulled back more. Most people think that because the tongue is attached in the front, they're not going to have the tongue fall in the back of the throat, but there's other bones here that are pulling backwards.
Interesting. So
Posturally can affect someone.
Oh.
Yeah, because if this bone is attached here and the tongue attaches down into the throat, it pulls the jaw forward. When your chin is down, then it makes you have an anterior pelvic tilt, and then it affects your knees and your toes because you have fascia that run from the front of your chin down the front of your body.
Wow.
The anterior fascial plane, and then you have the back one. So now the back one is pulling, so that's affecting your hips, so it's going to tilt.
Oh my God.
And then you're not going to breathe properly because your lungs are compressed. So it's all connected.
It's crazy. Like,
And the
learning
jaw
about
is
all this.
connected the same way.
Yeah, it's so interesting. It's kind of like I just recently got into toe spacing because I realized, wow, like my toes not being spaced are affecting my feet, which are affecting my hips, which are affecting my, like, it just works.
I know,
that
in the
way.
course I took, he said the tip of the tongue, there's like an energy meridian runs from the tip of the tongue down the front of the throat, through the nipples, into the hips, down the genitals of them, and then down the legs into the second toe.
Whoa. I
Of
mean, it
women.
makes sense.
And
It
that's
honestly
why
makes
in
sense.
India, women wear like a ring around their second toe, married women,
Yeah.
to control the sexual energy.
Whoa.
Isn't that crazy?
That is so cool.
It starts at the tip of your tongue.
Oh my God. I love learning about that
Yeah.
because it is all connected.
It is all connected.
That's
yeah.
wild. Okay. So that can be a cause of sleep apnea.
Could, yeah.
Like that could, for some people, maybe fix it.
Yeah.
Are there other things with sleep apnea? I feel like that's really common.
I think a lot of people have it,
Yeah.
mostly because the way our muscles relax in our sleep, and also probably the stress, because we don't. So that has to do with prana, life force. And when somebody develops sleep apnea, there's an obstruction of the life force. So like doing breathwork practices is so important because you're actually expanding your lung capacity, and then you're strengthening your diaphragm and your muscles around your head and neck. So then you
Wow.
have less problems. That's one of the things I recommend people to do breath work, because you want that prana to free up.
Oh,
So that's why people with sleep apnea, they don't live a long life because their prana start diminishing.
Yeah. Well, I have sleep apnea, but mine is super connected to diet.
Okay.
When I, no caffeine, no alcohol, no sugar, like if there's, and I mean, I don't drink very often, maybe like once a month, like, but if I drink alcohol, like I have it that night. If I'm having sugar, like once a week, I will have sleep apnea, like consistently. If I'm like completely sugar free, then I don't have it. And then dairy also, like I go through my phases, but if I'm in a goat milk phase, I will have more sleep apnea. So I notice it's like super
Do
dietary.
you snore?
Yeah. I like, I'm like, I stop breathing and then I'm like,
Okay.
wake myself up. But it's
Yeah.
super, if my diet is specific, I don't have it.
Okay.
But I also tape my mouth shut, so it's like less of an issue now.
Yeah. Mouth taping helps
Yeah,
with that because
yeah.
it keeps the jaw closed.
Yeah. But it's just interesting how it's all connected. Like,
Yeah.
and that runs my family too. But I wonder how much is like diet versus, I mean, the tongue thing is
Yeah.
interesting.
Or the structural, like
Yeah.
how big the tongue is, that depends too.
Yeah. I mean, I feel like I have a small airway.
Yeah.
Like, so I don't know. I need to do more breath work.
Yeah, because you're actually changing the whole. You can actually change the architecture of the airway.
Okay.
The Buteyko Clinic has training on that, like, and it
Okay.
has like courses and facilitators that actually can help you like restructure.
All right. This is my sign from the universe. I'm going to do more breath work after this. I'm glad we talked about this.
With breath holds.
Okay.
Yeah.
Yeah. Okay. I'm going to get into that. I like that. I really wanted to talk about veneers with you.
Okay.
Because one of the things that also I really was like happy about when I came here was just your approach with trying to preserve the teeth as much as possible. So many people I saw, they were just like, we need veneers, which I just don't think it was going to fix the issue at all. But, and I'm seeing this, so many people are just jumping to veneers. One of my friends, her daughter is 16, just got her braces off, and the dentist was like, she should probably get veneers soon. Like, they're just jumping to this. And I have a lot of friends who have those, like prepless veneers now. Like, people have those. I'm just curious, like, why is that such a big thing now? Do you feel like it's as necessary as a lot of dentists are making it sound? Like, I feel like everybody's getting veneers.
I would have to say that I'd have to see the person. It'd be hard to kind of just throw out a statement like that. But yes, oftentimes people think they're fixing, because we're so fixated on cosmetics that we're willing to give up the structure of our teeth sometimes, without even asking, like, okay, why are my teeth wearing down? Why are my teeth are discolored? Or what else is out there that's more conservative? So like I do a technique. I don't not like cutting into teeth, because I feel like, and my heart hurts, because it's like you're cutting away this something that's made by nature. So I do a different technique of veneering. First, like sometimes people have crowded teeth or they don't look good, and it's just enough to straighten the teeth and whiten them, and they look amazing. And then we do these very conservative injection molded. So I create like a mock-up of how the teeth will look like. We actually try it in the patient's mouth. Like oftentimes when somebody gets veneers, they don't even get to see how they're going to look like before they commit. So we try them on. So the person says, okay, I like them. We still analyze it to make sure it's correct. And then we literally just injection mold composite, like this ceramic type of composite onto the teeth, where I don't have to do anything to the teeth.
Is that what you did on some of my teeth? Is that the same thing?
Some of your teeth, some of your teeth, but this would be like the whole tooth would be covered with it, if we're adding length. So it just creates this beautiful uniform veneer made out of composite material that doesn't damage your teeth at all. And you can always shave it off if you don't like it. With all so it's conservative. It's not damaging your tooth. It's like adding back what's missing without cutting your tooth away. That's what I would try to avoid that. Like if you need it, you need it. But I think that I just would rather keep as much of it as I could. I agree with you. Yes.
And that it lasts a long time, right?
If you really take care of your teeth, the enamel lasts a long time.
In terms of
it's meant to last a lifetime.
Like that material, is that, and that's safe? It's like it's not toxic. Or anything.
It's not toxic based on the knowledge we have now.
Like when people are getting fillings and stuff, what kind of material is the safest?
So there's, again, we don't really have like a council on testing materials, but we would say like try to avoid BPA filled materials, have something more natural, like not natural, but not BPA filled. But we don't know like the BPB, and there's other things. So it's hard to talk on that, because there's so much stuff in everything that, and we have to use things that are FDA approved.
That too. But like, I don't know if somebody's getting a filling. I'm asking because this has come up recently with people I know. Is there like any material, if their dentist is saying, I'm using this, would be like a no-no?
Amalgam, like mercury fillings, that would be a no-no.
Is that even legal still?
Yeah.
It is?
They still use it.
That's crazy. Okay, good to know. Good to know. All right. So, I mean, I don't want to let this close without, if we're talking about ideal oral health care in terms of like morning routine, nighttime routine, like brushing routine and flossing, can you walk me through that? So, like, how long are we brushing for? Any specific technique, like anything specific with that? Flossing technique, what does that look like?
So when you first wake up in the morning, you should scrape your tongue, and then I would say brush your teeth gently, not for too long, but just brush off any plaque that's on your teeth. But if you eat a healthy diet, you're really not going to have a lot of plaque or bad breath. So do that, and then have your breakfast, and then after you eat your breakfast, then floss your teeth and brush your teeth. So flossing, using floss that's more natural. There's so many brands out there, but the most common commercial brands have like really toxic stuff in it that you do not want to use. So use something that works in your hands. The best is the traditional floss, because you have more control of it. And then using the toothbrush, ideally an electric toothbrush, because all you have to do is just hold it against your teeth and it does the work for you. And you should brush for 2 minutes. And most of these smart brushes that like Oral-B or Sonicare, they come with an app that tracks along where you're brushing and it tells you where to brush. So you have to brush the outsides of the teeth, the chewing side of the teeth, and the inside of the teeth, and each like 4 quadrants in your mouth. So you have to go through it. But these new toothbrushes actually guide you along.
Wow.
So you don't get lost. And if you forgot to, because often people forget to brush a certain area. If we're right-handed, we might forget to brush the inside lower right side. That's pretty common, and that area gets inflamed.
Yeah.
So the electric toothbrushes don't let you do that.
Yeah. Okay.
Yeah. And then so that carries you on till at night after you ate dinner. So that's about 12 hours of not brushing your teeth. If you eat like really high sugary diet, or if you know you have health issues or you have bad breath or gum disease, you really should brush your teeth after dinner also, and after lunch. And then at night before you go to bed, flossing again and brushing your teeth again, 2 minutes.
Does fruit count as sugary diet? Fruit
Not
sugar?
necessarily, no.
Okay. Water picks necessary?
Water pick is helpful for some people. Okay. Like some people that have a lot of receded gums and it's really hard to get anything in between, a water pick is helpful.
Okay.
Yeah.
Cool.
Or for lazy flossers, because not everybody likes to floss. I get that. So if you're a lazy flosser, at least water pick. Okay. And then floss every couple days. Because if you don't floss, bacteria poop in your teeth.
Oh my God. That's a good motivator.
They eat, that's a good motivator. Food that you left behind, and then they'll have a party in your mouth and they'll poop. And then if you don't believe me, smell your floss in the morning and it's going to smell like poop.
Oh my God. I cannot not floss. I feel gross. I'm like very sensitive. I don't like the feeling of things on my teeth. Like I have to floss. So can you floss too much?
I don't think so.
Okay.
You just can floss aggressively. Like some people like cut their gums with the floss. You have to be gentle with yourself.
I'm not like that. So just checking.
Yeah. Make flossing and brushing a meditative practice.
Yeah. Oh my God. I mean, I love it. It's soothing for me. So you have lots of exciting things in the works, and you're like in this study of Ayurveda. You're a couple years in, right?
Yeah.
And how long is it?
Was probably going to take another 3 years because I'm going to enter in the doctoral program.
Wow. Yeah. Awesome. Tell me like what that's adding into this practice. Like how are you integrating that now? The fine-tuning of constitutions and how to understand when people are eating incompatible foods or things that are actually bad for them, or how to guide them to the right daily practices for themselves or seasonal practices that make a difference. Like, for example, I had a patient that had bitter taste in her mouth, like horrible taste. She can't stand it. And it's been going on for a year and nobody can figure it out. And with Ayurveda, I was able to kind of pinpoint it to where it's coming from her diet and her constitution and how that's just all out of whack. Yeah. But all she was doing is just following recommendations based on dietary fads and books that she could find, but they were not fine-tuned to her. Yeah. So that adds another element. And then the intuitive stuff is kind of cool because I love to listen. I learned to listen to patients' intuition because patients know what's best for them or what's happening. So that's been really good. And I'm learning about the senses and I'm working around creating a program that how we can use our senses to reignite this biological intelligence that we have that is so powerful. Yeah. Where we don't have to rely on fads, we can rely on our own self to know what we need to do for ourselves. Yeah. And it's so empowering to know that and feel that and connecting with that, Yeah. And I just think the bio-individual thing is so important.
Or like so many people say I have ADHD, but it's just like the air and ether elements are not in balance. Like they're always going, there's lifestyle and the family, everything is too much stress. But they have no tools. Nobody teaches people tools how to just calm it down, bring it down.
Yeah. Are you giving just consults for that, or is it something you're just integrating in?
I'm integrating it. Eventually, I'll be doing. I'm working on figuring all that out. Yeah, and bringing in functional medicine stuff and just the fine tuning both of them. Yeah.
From your
now it's just part of everything.
I love that though. It's perfect. From your Ayurvedic studies so far, is there anything that's been game changing for you that you realized with your health personally?
Yeah.
Give me an example.
The example would be regularity to my life.
Mm.
Like when I eat breakfast, lunch, and dinner, and what time I go to sleep. And then meditation is big in Ayurveda.
Yeah.
So like I know how to bring my body back into balance really fast now, because I have a lot of air and ether and a lot of fire, and I need to like, and now I know there's nothing wrong with me. Because I used to think that something is wrong with me, nobody can figure it out. I know there's things in my environment that are pushing the limits for me, so I need to kind of come back and find a place where I'll take a couple of days off and just go up in the mountains and ground myself or read, or I know how to bring myself into balance, so I stay much healthier.
Yeah. I love that. So you're working on this course. How can people connect more with you and learn more about what you're doing?
On Instagram, we post a lot of things that are related to what I'm learning. Dr. Eniko Loud. But I'm working on a new website. It will be Dr.
Cool.
Eniko.
Oh, fun.
That'll be the evolution of me.
Love it. Just Dr. Eniko.
All these different things.
I love that. Well,
Yeah.
I'm super excited. I want to have you back on in the future. We talk more about Ayurveda and like integrate all of that. That'll be amazing. But I just love the trajectory of this, and it's just so cool to see her combining everything, and like I think just supporting people and feeling really like seen and heard. And I mean, it can be it's like a very vulnerable thing, you know, working on your teeth. I was telling Tyler that earlier, like it's very vulnerable. So I think it's really important that people feel, I know for me, like that somebody actually cares and isn't just looking at you like a number and like understands the bio individual component. So
the biggest shift for me, actually, now that you're talking about this, since Ayurveda, is that I see my everyday practice as a spiritual practice. You know, I start with the meditation, I clean myself, so then I could be present for that person, like fully present. Because I read this in A Course of Miracles that only a healed healer can heal. Yeah. And I think that's like, you don't have to be physically healed, but at least up here, you know, to kind of bring yourself back.
For sure.
Yeah.
I can relate to that. I'm like, my morning practice for myself, I'm like so centered on myself and everything I need. And that allows me to, for the rest of the day, like I'm not thinking about myself at all, and I can just be fully deeply in the moment with whoever I'm with. So it really is important, you know. I love this. Well, thank you so much. This has been amazing.
Thank you. It was fun.
Yeah, I can't wait for everyone to hear more. I know. So good.